Did you know that based on where your discomfort is in the hip can give you better insight diagnostically on what is going on? So the first area that we'll be discussing is the lateral or side of the hip here, and there are usually two things that could be going on. So one of the first ones is what we would call gluteal tendinopathy, which is the glute medius muscle that comes to the pelvis and attaches to the femur here. The second one is the bursa, which is underneath the tendons on the outer part of the femur here. Gluteal tendinopathy can typically cover a little bit bigger of an area. It hurts a whole lot more when you are loading it, specifically when you are on a single limb like walking or running. Trochanteric bursitis is typically a little bit more pinpoint, and it hurts when we put pressure on it, specifically like when laying on your side, and it'll feel a lot better when we offload it when we're resting or laying on the opposite side. Gluteal tendinopathy can also hurt when you are sitting with your legs in a cross-legged position. There are other conditions that can create this, but there's going to be a list on the side that you can check out. We won't be covering them in this video. The second area is going to be the crease of the hip here. There are three conditions that are usually responsible for discomfort in that area. One of those most common ones is hip impingement, which is pain in the front of the hip, typically in the joint here. So it can be located at the pelvis or on the femur. Hurts when going into hip flexion, so when sitting or deep squatting. It typically feels like a pinching sensation in the front of the hip, usually when sitting low, like on couches or in cars, and typically feels better when we stand up or go for walks. We have a longer and much more detailed video on this that'll pop up in the corner or in the description below. Labral tears are typically a tear to the cartilage inside of the joint here. They are usually a progression of hip impingement when not treated properly. They usually are pain-free. Some of them can be painful. Most of the time they correlate with clicking and popping. We won't be covering this completely in this video. Hip arthritis is typically wear and tear to the cartilage and the joint inside of the hip. It's usually found in the older population and can present like a skipping or a decrease in range of motion of the hip. And this usually happens when there's improper movement in that joint over time. There's the wear and tear to the cartilage and to the joint specifically. If this gets too advanced, a hip replacement might be advised. Treatment for hip impingement and labral tear is typically a combination of some manual therapy as well as exercises that works on better movement through the pelvis, like core exercises and glute exercises, and then proper loading over time. If you guys need help with this, remember we do offer services virtually or in person, and our contact is below. Hip flexor tendinopathy is a broad term for things like inflammation or wear and tear to the tendon of the hip flexor muscle that attaches from the pelvis to the femur. This usually occurs in the population of those like dancers or runners where a lot of hip flexion occurs. Usually gets worse with activity, accompanied by stiffness after that activity. Usually it can feel like a pulling sensation of the hip. This can be treated with proper rest and manual therapy, but usually it's about changing movements over time and getting better areas around the hip to help out so that it can relax and heal. Not only does it hurt with hip flexion, but it'll increase even more when you resist that hip flexion. There are a bunch of other conditions listed on the side that we won't be covering today, but can typically present like the ones we did cover. The next location is not just the front of the hip, but kind of off to the side where the bone on the front here is located and just underneath that and behind it. Here's the TFL on the model. It's actually not presented here, but is usually located where my finger is in this area. And what that muscle does is it's actually an accessory hip stabilizer, attaches to the IT band, which is that big fibrous material that runs down the side of the thigh and attaches to the outer part of the knee. This pain usually presents with things like laying on your side and lifting the leg up and down. It also presents in running over time or running really fast. Usually gets better after hip activation or glute warm-ups and can help with that pain during running as well. The next location we will be covering is the lateral thigh, so the outer part of the thigh here. Most of the time when people have lateral thigh pain, they think it's the IT band because that is the fibrous band that runs on the side there. But IT band syndrome does not present with pain on the lateral thigh. It actually presents with pain and clicking in the lateral part of the knee. So what we really want to consider when it comes to the diagnosis of pain in the lateral thigh is the L5 nerve that can run down there. If you want to know more about IT band syndrome or clicking on the side of the knee, we have another video that you can check out. L5 nerve irritation feels like pain, burning, possibly numbness or tingling that runs down the side of the thigh. It not only can it present there, it can migrate upwards into the glute or into the low back, or past the knee into the shin and the top of the foot. It doesn't have to be all of those areas. It can present in one of those areas, multiple of those areas, or feeling like it's the top of your foot pain, shin pain, glute pain, and it might change day to day depending on how bad it is or what you did with activity. You don't necessarily need to have back pain for this to be coming from your back, which is where that nerve originates. Just a proper examination can tell you if this is true. To treat L5 nerve irritation, a lot of times it just comes with finding where it's being irritated at, which most of the time is your lumbar spine. So finding positions, stretches, or exercises that can help you move better through the area and offload that nerve root is usually the answer. Meralgia paresthetica is an irritation of a nerve branch that comes off of L2, L3 in your low back and supplies the skin sensation around the lateral thigh and some of the front of the thigh as well. This typically presents in people post-surgically, like C-sections or those after hip replacements. A lot of times too, it can present with somebody who usually wears something really compressive around the hip area here, like belts or gun belts. Treatment typically is identifying what exactly is causing this nerve compression so we can reverse that, maybe if it's habits throughout the day or the surgical scar that needs to be worked on manually. But rehab and exercises can also be a part of this treatment journey. There are also other conditions listed on the side that can present with lateral thigh pain. We won't be covering them in this video. The next area we will be covering is the inner thigh, pubic bone, and lower abdomen here. Sports hernia is typically what people are worried about when it comes to pain in those areas. A true sports hernia is where the abdomen comes down and attaches to the pubic bone. That also runs over the adductor muscle on the inner part of that thigh that comes up and attaches to a very similar area on the pubic bone. People will typically get this in sports like hockey and running. You'll feel those a lot of times when you are reproducing those leg motions, as well as with sit-ups, leg lifts, coughing, things of that sort that can reproduce pain in that pubic bone, lower abdomen, and inner thigh. We have another video that'll go over the assessments that we typically do in here to confirm or deny a sports hernia. But one of the things that you can do at home as a good self-test is by grabbing a weight and just putting some resistance here in this motion with your leg, trying to push it across the body. If that reproduces discomfort, it is likely that this is something you should get checked out. Adductor tendinopathy is typically an inflammation or irritation of the tendon of the adductor muscle. The adductor muscle is shown with this resistance band here. It runs from the knee up the inner side of the thigh and attaches to the top of the pubic bone. But where that tendon is located is at the top half here. There are different muscles on that inner thigh that is responsible for the motion of adduction or bringing your thigh inward. They all have different referral patterns, which can be located more on the front side, more in the middle of the thigh, maybe somewhere closer to the hamstring on the back side is where you can be feeling some of these areas. For example, this is the adductor magnus referral pattern. Here is the gracilis and the pectineus. There are certain exercises that can bother these areas, which are typically things like a Copenhagen exercise or the squeezing machine at the gym. So squeezing the knees together can reproduce this. I had a patient with horseback riding where it's just kind of holding onto the saddle to stabilize herself, reproduced some of that discomfort. Treatment for this can vary depending on the severity of the injury, but most of the time it can be treated with a progressive program that loads the area and promotes healing. Other conditions that can be responsible for pain in the lower abdomen inner groin, and inner thigh are presented on the side here that we won't cover in this video. Special note, keep in mind that sports hernias are not real hernias. It's kind of a diagnostic term that should be changed to something like athletic pubalgia, where we are involving the tendon and the muscle attachment to the pubic bone. True hernias are completely different. The next area we will be covering is the back of the hip, which typically includes the piriformis and the high hamstring. Special note, remember that L5 referral pattern we discussed? That also can cover this area. The piriformis is located on the back of the hip. It'll run from the sacrum to the femur. The piriformis is a muscle that runs very close to the sciatic nerve, and everybody's a little different in where that sciatic nerve will present with that piriformis. Sometimes if numbness and tingling is involved, it goes down the back of the leg, we might be dealing with a nerve involvement with this piriformis issue as well. When just the piriformis muscle is involved, it can typically feel like a tight glute. It'll usually decrease range of motion in your hip. Hurts a lot to sit on it. Maybe with some glute exercises, it can aggravate it. Feels better when you lay down to relax or just go for some light walking. Stretching is also really helpful for the piriformis muscle. Special note, those of you who have large wallets that are in your back pockets and you sit on them can put compression on this area, so taking them out and not sitting on them can give you some relief. Treatment typically involves making sure that the piriformis muscle is actually responsible for your glute pain. Stretching is helpful, manual therapy can be helpful, as well as some light exercises to help mobilize the area and build stability around the hip can help as well. All right, the hamstring attaches from the ischial tuberosity, which is your butt bone you're typically sitting on, and runs down the back of the leg here. The pain with high hamstring tendinopathy typically presents where the tendon attaches at that butt bone, the ischial tuberosity. So it can feel like pain underneath your glute fold and a little bit into the upper hamstring. Most of the time, people with this issue will complain of pain when sitting for prolonged periods of time. As it gets worse, it can be painful even after a few minutes of sitting. We will a lot of times see this in the running population as well, especially those who train hills, speed work, and long distance running. Overstriding can also contribute to pain in this area as well. Treatment of this area can include some rest, maybe some offloading of the area or changes to your program, a combination of manual therapy and some rehab exercises, which a lot of times will involve isometric exercises for the tendon. Takeaway from this video is that there are a lot of conditions that can present in different areas around the hip. If you want to know more specifically about the front crease groin of the hip, check out the video here. And if you want us to help guide you conservatively for these conditions, we'd love to help you out.